we're talking with Lucica Ditiu of the Stop TB Partnership. So, Dr. Ditiu, please give us a snapshot of what the projections look like for TB by 2050.
So by 2050, one of the targets of the Stop TB Partnership is that we will eliminate TB by 2050, which is, less than 1 million cases per 100,000 population, which I hope we will be there. But by 2050, if we don't do that, the world will have to invest a huge amount of money in taking care of this disease, or in trying to avoid that we are dying a painful death of this disease. So basically, some of the worst predictions are done by the panel on antimicrobial resistance nominated by David Cameron. And the chair of this panel, Lord O'Neill, who participated in the Stop TB Partnership Coordinating Board just like yesterday, 2 days ago, predicted that there will be a need of around $17 trillion for drug-resistant TB to be properly contained by the year of 2050. So for some of us, this is incredible because it's a huge amount of money, and we can spare the world this money if we are properly taking care of TB right now. In addition to this, the other prediction by 2050 is that 70% of the population will live in cities. So we speak here of a urban planet, and living in cities will have so much, 70%. It will mean crowding. It will mean poor housing conditions. It will mean everything related to the change in the climate and pollution will have an effect on people. And we know very well that TB goes hand in hand not only with poverty, but it goes hand in hand with everything that has an effect on the immune system or on your health status. It's an indicator of a very weak program, and is like coming up in the moment in which the individuals are having an issue with their own health. So by 2050, we are hoping that, I hope that even though these predictions are very real, for some of them we are able to fight back, and we are able to reach the positive one, that we will eliminate TB by then.
Mm-hmm. Given the billions of dollars put into TB over the many years, how is it possible that the tests that are still being used for TB are more than a century old?
It was, money were put, there are two main reasons for that. First is that our biggest investments in TB are coming from domestic. And it's around 6-7 billion a year, and it's like every country putting in their own programs, and is never enough. A big chunk of this comes. Russia reports out of this 7 billion, 2 billion. It's a big amount, and a lot of it, even for the rest, which are pieces, is going very much into care and treatment. Very little goes into the research. So basically, the research for TB was heavily underfunded and neglected for hundreds of years, basically, and especially in this century. And what we speak now, we are funding a treatment action group to put every year a report on research and development and funding. And consistently for the last 3 years, we report around 600 million that are going for research. That is a fraction of what HIV world gets, for example, and that's not enough to really ensure a pipeline for diagnosis, for vaccines, and for the right treatment. So the money were never enough to really drive the development of a new tool. But the money were not enough because attention was not enough, and we were not able to scream and to say that in the year 2015 we are still using the microscope to diagnose TB. So we were not able to make the case and to make the arguments, and for whatever reason, TB seems to fall from the agenda of the big donors and the big investors. It's there at a minimum level, like to survive, but not enough to strive and to really show a big progress.
Mm-hmm. And one final question. All of the pockets of refugees around the world, what are your concerns about TB among those populations?
Huge, actually. And you know why? First is that I expect that a lot of these people are already having TB, and some of them might have even have it diagnosed and the treatment started. But when you are faced with a drama that these people go through, your TB treatment is probably on the last list of priorities. So I expect a lot of them to already have TB, and that's why carrying it with it is not only that they will become even more ill, and what God help us probably die even for them, but also they will really for sure transmit it to those they are in contact with. And we know very well conditions that till they reach their final destination, to say so, even though it's not a final destination, they are going through a lot, before they are getting a place where maybe they are not that sleeping or living in the same crowded places. The other point is that a lot of them will get it. But as I said, and we started conversations as Stop TB Partnership with some of the recipient countries on trying to see how we can help in addressing TB. You know, we supported with drugs Lebanon program, Lebanon government, because they had a lot of refugees and they were not ready to deal with it. They were not prepared with so many drugs. So we provided Lebanon and Jordan with this. Now we are discussing with we discussed with Germany actually, and they were unbelievable rapid in even opening some wings to receive people with MDR-TB, because wings of hospitals, so they were really moving things around that in case patients with MDR-TB come, to have the proper conditions and under proper infection control measures. But it's a heavy task, because we know that they probably are a lot, and we know that it will be very difficult for them to go and present themselves. TB is difficult, but they will have other bigger worries, and that will make them becoming sicker and infecting others around them.
Thank you, Dr. Ditiu.
Thank you.